Kenyans will be barred from bars, restaurants and public transport from the 21st December if they are not fully vaccinated against COVID-19. The measures are aimed at increasing the rate of vaccinations ahead of the festive season. Less than 10% of the population is currently vaccinated, about 6.4 million people. Well, it's well over that deadline, and Dr. Lucky Mwange, a general practitioner, joins us for more from Nairobi. Welcome to the program.
Okay, thank you for having me.
And thanks again for joining us. How are you feeling this period, especially having caught COVID-19?
I'm feeling good, actually. This new variant is very annoying. It's not as lethal as the other variants that we've been having. Mostly muscle aches, lower back pains, but we are not seeing much of breathing difficulties. So it's not been a bad experience as the other variant was. But yeah, I'm feeling well. I can't complain.
So you've not had to be hospitalized and due to this variant. Also, if you could share with us how you think you might have contacted the Omicron variant.
Oh, definitely I contacted it in hospital because last week, but one, we've had this really high surges in COVID. We are speaking about more than 30% positivity rate. So I happen to be in a facility where only one in 5 patients. Okay, let me phrase this as 4 out of 5 patients presented with the same complaints: sore throat, back pains, muscle aches. So it was really high. That's where I think I got it from, because as a doctor, you have to examine the mouth, you have to examine the tonsils, you have to do this close examination. That's where I'm sure I got it from. There was no way I could have escaped that. With such a high complaint rate of Omicron, which I'm sure was affecting these patients, there was no way I would have escaped it.
And also, this is inclusive of being vaccinated, the complete dose, and perhaps a booster shot as well.
I had not gotten a booster shot, but I am fully vaccinated, 2 AstraZeneca shots. And yes, I've also encountered people who have also gotten this from, like myself, 2 fully vaccinated individuals, but I've not encountered anyone who has gotten a booster shot and is complaining of the same symptoms, although I wouldn't expect it, since we are now being encouraged to get booster shots currently. So that will have to be someone from abroad, maybe, who got it, but locally, no one with a booster shot has complained of it.
So we know the AstraZeneca vaccines is most commonly used vaccine in Kenya, and the 2 doses required to be fully vaccinated are supposed to be given at least 6 weeks apart. So in terms of the numbers now, how many people have been fully vaccinated in the country?
We're talking about, okay, in the adult population, I'll base it on the adult population, since for the pediatric population, now that's when we are being told to vaccinate those above the age of 15. So for the adult population, we're talking about around 14.5%. This is data from the Ministry of Health website. So 14.5% of adults have been fully vaccinated. So we're talking about a total first dose of around 5 million individuals, with a total second, okay, fully vaccinated adults, we're talking about 3.9 million. We're talking about 9 million adults who've been vaccinated. These are people who've received at least 1 dose. So 9 million, the first dose, 3 million fully vaccinated. We're talking about 5 million who've received the first dose. So in terms of the fully vaccinated individuals, we're talking about 3.9 million adults. That's about 14.5% of the adult population.
And Kenya's total population is about 50 million. But if we look at, the concerns that some African countries have, shortage of vaccines, the Kenyan government says it's confident that it has enough for its inoculation. What other campaigns is the government embarking on to stem the spread of COVID-19, especially with the Omicron variant?
When it comes to stopping the spread of this vaccine, we are dealing with main pillars such as the quarantine for those who have it. We're talking about social distancing to reduce the spread. Also, the issue of vaccinations. Now, when it comes to the first two, there is not really much control you can have because you cannot ensure the quarantine of a third of the population. That's something you cannot do. You can also not ensure that everyone is social distancing. That's a personal responsibility. But when it comes now to this issue of vaccination, that's where we are seeing a push and pull, where now we are having things like now vaccine mandates being given, where now things like malls, I've actually seen malls which have started denying people who aren't vaccinated, malls like the Junction Mall, to quote it, we've seen it, and various malls are doing it. Churches were also asked to do that, but they declined. So I would say that's the main initiative that's currently being conducted, trying to enforce a vaccine mandate to ensure that those Kenyans who require these services actually go and get vaccinated so that they can get these services. Yeah, so I think that's the main current initiative.
Let's come back to perhaps some of your symptoms. And this is, drawing the comparison between the variant, Delta variant, with what some of your patients have experienced and your experience, your symptoms for the Omicron variant. Are there any, what's the difference?
Okay, I would say I'm fortunate or unfortunate enough to have suffered COVID twice. So I got the first variant in 2020 November. That was when I was in a pediatric rotation. So for these other variants, you were having respiratory symptoms. So mostly cough. We were not having muscle aches and joint aches. That wasn't really prevalent. That wasn't really a very high presenting symptom by the patients. So most patients were presenting with respiratory symptoms. Now with the Omicron, most of the patients are actually complaining of, it has the same sequence for most of them. They tell you they start with a sore throat, then after around 24 hours, they start developing muscle aches. So the most common areas reported by the patients and also for myself was your shoulders are aching, and surprisingly also the gluteal region. This is the buttock regions aching as well. Then we're also having back pains. So we're having lower back pains, we're having upper back pains, and then just generalized body malaise. And malaise is the fatigue and feeling tired throughout, and the muscle aches. Actually, to a point where people were actually complaining that when someone tried to tap them, tapping someone, they feel pain at the region of tapping. So I would say that's the main difference that I've noted. Omicron presents mostly as annoying symptoms which are really annoying, not like the other. Okay, for me, that's what I call them, because these presentations are actually, most of the patients came because they were actually pissed off by the symptoms. Why am I having back pains? Things like that.
Quite annoying, but we appreciate your time. Thank you so much for joining us to talk about this. Dr. Lucky Mwangi, a general practitioner, joining us from Nairobi, and do get well soonest.
Thank you. Thank you for having me.
Thank you very much.